Good, happy Friday morning, everyone. I'm Jill Chadwick, and for Dr. Stephen Stice, Chief Medical Officer. We are coming to you from the Dolph C. Simons Jr. Family Broadcast Studio. With us in studio this morning, Amanda Gartner, Director of Quality and Safety, and of course, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. We're going to answer your questions today, but first, Dr. Hawkinson, how are the numbers as we head into the weekend?
They're good. I mean, overall, the numbers in the hospital are good. Better than what they could be. We have 23 patients in the hospital right now, 6 of those in the ICU, and 3 of those on the ventilator. So we're doing pretty good. We would certainly like to be in the teens, but I think we are going to be seeing those fluctuations as we have. Any number that is lower is better, but it just is kind of a day-by-day thing and a rolling 7-day average thing. So certainly I think our numbers are doing pretty well right now, and hopefully they'll stay that way through the weekend.
And I was checking to see what the Hays numbers were because I'm supposed to give them to him much earlier, and I just haven't gotten into the rhythm, just to be completely and totally honest. And it looks like we've got, I'll let you interpret the graph. Same as yesterday?
So total 17. There are 15 that are what they consider the active, but still 2 that are in that recovery period. So they're still in the hospital. They went to the hospital because of COVID. And if it wasn't for COVID, they wouldn't otherwise be there originally and wouldn't still be there. So 15 active there at Hays and 2 in the recovery period after the acute infection period.
And I know that you and I were on a call yesterday, and just to be completely transparent, which is what we do on this program, there were people that said sometimes in the community they think, well, if they're not on a ventilator, then they're not that sick. Mm-hmm. Can you clarify that for us? I mean, if you're in the hospital, you're sick.
If you have to go to the hospital, that's a huge burden, and nobody wants to do that. And if you have to go to the hospital to seek medical care, you never know what can happen once you get into the hospital. There are always complications. Other things can happen with your bodies. If you're ill enough to go to the hospital, that's pretty significant. We don't know the details of all those patients, but we do just here, even here, we have patients who are in the ICU who need critical care services, but they may not be on the ventilator otherwise. So they're needing other support services, treatment services, and things of that nature.
And something to add to that, there are patients who are critically ill, but their desire is not to be intubated. So they don't want to be on that ventilator and have that mechanical ventilation. Mm-hmm. And maybe they're really towards more the end of their life, so they're absolutely critically ill, but their wishes are to not have a tube in their throat. So just because they're not on the ventilator doesn't mean they're not critically ill.
And in general, just to that point as well, we do try to avoid being on the ventilator or getting intubated as long as possible if you can otherwise do that in a safe manner for that patient.
Why is that?
Just because we know that once you get on the ventilator, especially with this disease, it is very difficult to come off, and you will remain on the ventilator for 10, 14, 21 days sometimes. So.
And what happens to you after you do that? I mean, because I get stiff when I just sleep overnight.
Absolutely. It introduces a bunch of different risks. You put an artificial airway in, and now you have to ensure that we are providing good suctioning, keeping that airway open and clear. You're not able to turn yourself like you would if you didn't have that artificial airway in. So it does add to a variety of other complications that might arise just due to the ventilation itself.
I think I have recalled that Dr. Stites has mentioned that people that are on the ventilator, a lot of times they have to get discharged to another interim facility to help them just get physically back.
Mm-hmm. The rehabilitation process is usually a higher demand when you have mechanical ventilation.
Yeah, absolutely. Yeah, and again, anytime you have a procedure done to you, people say, well, it's just a small procedure. It's not a small procedure if it's being done to you. And that includes coming to the hospital and getting on the ventilator. As Amanda had talked about, anything that really happens, there is a risk, and having being intubated and having that artificial airway does put you at risk for other things such as hospital-acquired or ventilator-acquired pneumonia. If you are unable to move, you are at risk of pressure sores and things of that nature. So everything comes with its risk, and we try to minimize that as much as possible and stop those types of complications, but unfortunately sometimes they occur.
Well, I think the best advice is let's just don't get COVID. And so with that, we are going to go into the questions that we might have this morning that will address different ways to help us keep safe and answer some questions. Bob Hallinan, he is with us again this morning to take the questions. And do you have media ones?
Well, let's find out. Hearing none, let's forge ahead with some of our viewer questions. Amy wants to know, can someone explain the percentage positive rates? I received the daily emails from Johnson County Health Department, and Johnson County is saying we're at 12.5%, but the other day a doctor was mentioning something about Johnson County 6%. Our high school also mentioned 6%. It's confusing. Can you help clarify that?
Yeah, I think that mostly depends on where your source is coming from. I know that you talked about the emails from the Johnson County Health Department, things of that nature. You know, sometimes there is a delay in reporting. Overall, going to that exact number, we do want the percent positives down. We also want to increase testing. That will help drive down the percent positives. That is to get more people tested. When you have more people tested, you start to understand really how much more disease or how much spread there is in the community so that you can get a better handle on the isolation, on contact tracing, and keeping other people safe. So, yeah, unfortunately, sometimes there are delays or lags in the any of those statistics that are presented, and it can be due to that, but it also can be more accurate or updated information later as they go back retrospectively and do that.
Yeah, even within our organization, our data changes hour by hour because new test results are coming in, patients are being discharged. You know, the county has multiple sources for their lab results coming in, so it really has to do with the point in time in which that number is released. It could be very different just within an hour if new lab work comes in.
And I think for this program, do you want to explain when you get those numbers and how they change? I know that with the Hays numbers, I saw the email and it came in at 6 a.m. this morning. So we're getting pretty current numbers, but it could change by noon.
Yeah, and it changes as the results are resulted, as the tests are resulted, because we do have several runs a day, and so that matters as well. But again, to Amanda's point, we do have discharges, we have new people being admitted, all those types of things. So there's a lot of details that go into that.
Yeah, each morning I I look at the inpatient census and I look at those that are positive and those that have recovered, and generally send an email to Dr. Hawkinson, try to get it earlier than 8 a.m. But usually pulling that information between 6:45, 7:30 in the morning. But again, if we were to look at it right now, there's a chance that we've had new admissions, new results, discharges. It changes, or they meet recovery status and we've discontinued them from isolation.
And we try to give, as again, I think these other sources do, the most up-to-date information, but we have to not be so focused on that one point in time, but more things like 7-day, 10-day, and 14-day rolling averages.
Is there any advice, and then we'll move on to the next question, but if I were this person, Amy, at home, I'd be like, well, so do I believe the 12% number or the 6%? Is there a source of truth that you would recommend people go to? Is it KDHE or?
I mean, I think all of the county and the state health departments have reliable information. I think the real takeaway is that it's still prevalent in our community. Yeah. We're still seeing a rise in many of our counties. So I think it's that number really shouldn't change our behaviors at this point. Once we get a stable number and it's on the decline and it stays on the decline, I think that will give us a different message. But as of right now, I think regardless of if it's 6, 8, 10, 12, we still have a high positivity rate, and it's still very active in the community.
And I'll also speak to the guys in Master Control. I think earlier we, in a broadcast, we Mark had created a website where they are trying to aggregate a lot of that, the Mid-America Regional Council, and so I'll see if the guys can find that, and we'll put that up a little bit later. I believe it was Protect KC, something like that. That's a hint. All right, Bob, let's go to the next question.
All right. A viewer wants to know, on Doctor Radio, they said a study shows there has only been one case of transmission of COVID-19 outdoors, and that was face-to-face contact. Is this true?
So I don't know this particular study, but I know that we have evidence just within our local area of transmission in outdoor settings, examples being outdoor weddings, We know that there's been outdoor funerals that have had transmission associated with them. The Lake of the Ozarks, the photos we've seen with that. We know that there was at least one case that was shared or released after our home opener, unfortunately, at the Chiefs game. So I don't think that's accurate that we only have one known case of outdoor transmission. The dynamics of transmission don't change significantly if you're still outdoors and you're not masking and you're not socially distancing. You're still putting yourself at risk.
Yeah, I mean, I think you adhere to the same things, especially distancing outside. Certainly if you're congregated close together with a lot of other people outside, such as a concert or something of that nature, there can be spread. I'm not aware of that one case, but again, it is one case. It doesn't really make any changes to the large concepts that we already understand about this virus.
Right. I think we found the website. My guys are so great. Do you want to throw it up there so that we can see what it is? I can't see it, so...
Looks like it's the Kansas City Region COVID-19 Data Hub. I can't see the actual website, but it looks like it's been published or posted by Mark, M-A-R-C.
Okay, so that's for Amy and anybody else that's interested. I think you're seeing it on your screen, and I'm getting a big thumbs up that you are. And there we go, right? And you can write it down, and my understanding is they keep that pretty updated, and they are aggregating from a lot of different places. So our thanks to the Mid-America Regional Council for doing that. So. And
again, I think kansascity.com, the Kansas City Star, also has a coronavirus section which they aggregate from the Core 4 and things of that
nature.
Right.
So, you know, you got resources in the community. Okay, so our next question is, do you think that there will be a big rise in COVID-19 cases this fall and winter?
So I think the tendency is that we're going to be pushing folks indoors, and we're now we have seen behaviors where folks have been getting together and congregating in the outdoor space. So as they transition indoor, it really is going to be a matter of, are they safely distancing? Are they using the pillars of infection control? We know that indoor spaces are typically smaller than outdoor spaces. They may or may not have the same ventilation as an outdoor space. So the risks definitely increase. We've said all along, outdoor is better than indoor, but it really has to do with the activities that you're participating in and who you're spending time with and the duration of time you're spending with folks. So I think yes, I think we will see an increase just because I don't think we've completely mastered the behaviors that we know can prevent transmission.
Yeah, and certainly we know that from even in our local community, while it's still been nice out, over this past week, the daily new infections in the Kansas City area have increased from where they were the 7-day rolling average. So I think even yesterday or Thursday they had over 350 new cases. So cases are increasing. Now, are there going to be the hospitalizations and the overwhelming of PPE and the overwhelming of our supply chains? I hope not. Mm-hmm. Certainly that hasn't really shown to be true in Europe, which is now being hit very hard again. I think that has to do more with the infection dynamics, though. We do know that 20% or more of new acute infections are in that younger age range, the 20s for ages. So I think that certainly helps. We've always said that 80 to 85% of people will never need to seek medical attention. We know you're at higher risk if you're older. If you're younger, you are at less risk. Doesn't mean it can't happen, but you are at less risk. And especially if we have these younger kids that are being more prevalently infected compared to older populations, you're probably going to see a rise in cases. Hopefully not the rise in hospitalizations, but we know even younger people can develop complications and severe illness from this.
All right, Bob.
Another viewer says, I've heard the 6-foot spacing recommendation has now been increased to 8 to 10 feet. The CDC has been confusing. Can you all clarify this?
Do you want to?
Yeah, you can go.
Okay. Well, I know that what we know is that 6 feet of social distancing has always been the recommendation. But we've also said if you can be farther away, the farther away the better. 10 feet is better than 6 feet. Outdoors is better than indoors. So the CDC has been a little bit confusing from time to time, but we anticipate that with the pandemic because we are, what is it that you've been saying, building flying while we're building the airplane.
Yes.
So I think, again, the takeaway there is maintain the distance, and if you can do 8-10 feet, that's better than 6 feet, but 6 feet is what we've generally been recommending.
And again, you know, the World Health Organization originally said 1 meter or 3 feet, and that's because the populations, the whole world that they have to give advice to, some of those communities may not be able to space 6 feet or 8 feet. Here, the recommendation had always been 2 meters or 6 feet. That was the start point. Again, this isn't black and white. Understand the concepts. Distance is better than proximity. So if you can be 6 feet, that's great. 8 to 10 feet is even better. That's what that is. It is definitely confusing with all these retractions and new things from the CDC, but that guidance really hasn't changed. We've always promoted further apart is much better than closer. And
I think it's important, too, to take into account what activity you're participating in. If you're walking quietly by yourself and you're going to walk next to somebody, it's probably less risky than if you're shouting, screaming, singing, talking, those activities that might generate more droplets. So taking into account exactly the activity that you're participating in. But again, the more distance, the better.
Yeah.
All right, next question. I have an autoimmune disease and I take biologics. Should I stop taking my medications to allow my immune system to build to guard against COVID-19?
Yeah, absolutely not. I think you need to, first of all, discuss with your care team, especially the physician that is prescribing those biologics. But we've always maintained that we need to continue our preventive medical care as well as our treatment for our chronic medical conditions. I would certainly, there is no evidence and no guidance to suggest that you need to stop taking your current medications that are managing your current chronic medical condition. So I would advise not to stop taking it. I would advise to have discussions with those physicians, though.
Bob?
All right, viewer wants to know, should a person get antibody testing before getting the vaccine when it's approved? Maybe we won't need the vaccine? There's a question mark in the end of that.
Yeah, and my gut tells me that antibody test wouldn't impact your need to get the vaccine. I don't know if you have additional information on that, but...
No, I would agree. You know, from what we're seeing now, we certainly have seen at least 2 published reports of reinfection. It's unclear what exactly an antibody test means, especially further out from the infection. We don't know how durable our immunity is after we've had the infection. So I don't know that getting an antibody test is going to change anything when and if a vaccine is approved.
All right, next question. You talked earlier this week about assembling a team of medical professionals to deal with the lingering effects of COVID-19. I know sometimes people have called that long haulers. What are some of the medical issues this team will address, and will you have a psychologist on the team?
Yeah. Well, we are currently working on a COVID recovery clinic per se. It is multidisciplinary. A lot of it's going to involve the primary care physician, so the people that are seeing people every day, internal medicine physicians, but also family medicine and other clinics, Jayhawk clinics around our community. So they will be dealing a lot with things like the muscle aches, the fatigue, things of that nature, the general ones. We will also be including neurology in case there are some effects after, such as maybe brain fog or other lingering effects that may be accounted for by COVID recovery, but also especially pulmonary. So pulmonary will be involved because a lot of people do continue to have shortness of breath. They may have a decrease in their lung function. We're also including cardiovascular medicine as well. So really a lot of those. And then other subspecialties will be available as needed. Psychiatry and psychology will definitely be involved as well. So we are going to hopefully have this multidisciplinary clinic, or actually access to this groups depending on what the need is, because some people don't have any other symptoms other than still shortness of breath, but other people have no shortness of breath or cough even after infection, but may have lingering fatigue or myalgias, muscle aches, things of that nature. So it is really going to be catering to that individual patient and what their needs are.
I know that when we started out early in this pandemic that you talked a lot about COVID toes, about rashes, about GI problems, about kidney problems. Do those things still exist?
Yeah, absolutely. We have to understand that a lot of these things are not unique to COVID. So certainly the loss of taste or smell, that has been seen with other viral respiratory infections as well. Now maybe is it a little bit more prominent, or we're noticing it more because of all this pandemic, that may be. But things like COVID toes, or pernio as it's called, has other causes as well. So a lot of these things are not specific or pathognomonic for SARS-CoV-2 infection, but we are seeing it with that. So we'll be able to deal with that as needed as well.
All right, Bob.
All right, fact or fiction, children are immune to COVID-19.
Fiction.
Yeah.
We know that we've had children of all ages have been tested and positive for COVID-19. I don't have statistics on the significant illness that they experience, but we do know that they're not immune.
I know, too, that I have a friend, and she has a child that's under age 5, and the child's back in school, like a lot of them are. And when she called up to, because the kid now has, her child now has sniffles and, you know, some symptoms that make you worry. When she called up, she said, not too many kids are getting this, right? And they go, oh, no, we're testing a lot of kids. So it's interesting.
Yes.
Yeah. No, children can absolutely get it. That's fiction.
Okay, so here's one that is worth talking about. The viewer says, you guys are spread out without masks on. Why are we holding children to different standards, saying they cannot be spaced out without masks? Are children less likely to get sick? So why don't we address what we're doing here and why?
Yeah, well, I'd first like to address that second one. Children certainly are at less risk of having hospitalization and critical illness and death, but they still are at risk. It's a very small population that goes to that in infected children. So they are absolutely able to get the disease, but more important, even if they have little to no symptoms, they can still spread the disease. So they are still infectious. And as far as the first question, I believe it was, we are spaced. This is for a very specific time point. Our masks come off right before we sit down. We are spaced apart. As soon as the show is over, we put our masks on. Walking in the hospital, anywhere else in the offices, we have our masks on. I even wear my eye protection in the hospital as well. So I don't think we are holding children to different standards, but we do understand that for children, it is much more difficult to maintain that spacing. Sometimes if they're younger, although what I've seen is that younger children are really being able to wear the mask pretty well. But certainly the spacing and things of that nature, the physical distancing, is probably a little bit more difficult for children, especially in those younger age groups.
Yeah, I would just comment that this space is extremely controlled. The doors are locked. There's not any unexpected visitors. We're typically not speaking directly to one another. We're looking at this angle, and we've acknowledged it's very difficult to give a public message whenever you've got a mask on. To Dana's point, we all come in here. The environment has just been cleaned. We take our masks off as soon as we're done. Masks on, hand hygiene, environment gets disinfected. So I think it's a very short duration. It's an extremely controlled environment where in a school setting, there's a lot of unknowns, unexpected things that can happen. And so that's why it's important for students of all ages to be masked and socially distanced.
And the engineering controls and air turnover here,
yeah,
too, in this setting.
And we're not laughing and shouting.
Well, sometimes we are.
Yeah, we do.
Stites sings to
Yeah,
Dana.
a little bit, but not as a rule. So, Bob, you have another question?
Yep, I got one just in from a viewer, Diane. Okay, her kids have been playing outdoor soccer. So far, it's been going well. Everyone's staying healthy. But the team plays indoors over the winter. And the indoor facility is big, but it's still indoors, and so there's a risk for infection, supposedly. So she's asking, should we push for the players to wear masks while playing indoors, or is it still okay for them to only wear masks while on the sidelines?
So I think the indoor soccer facility is likely large enough that it's going to have really good ventilation. I know that even in the outdoor setting, some soccer teams are wearing masks during play, especially on the sidelines when there's more likely longer duration of congregation between folks. Again, the rules don't change as it relates to socially distancing. If you can stand on the sideline and be 6, 8, 10 feet away from the next player, that increases your likelihood of not getting COVID-19. I would be curious as to some of the other components of, are there going to be different rules for spectators in an indoor setting? Because as you add more people into that space, it would likely increase the risk of transmission. But again, it depends on the activity, the exposure, the duration, and that proximity to other people.
Yeah, I still think it'll be certainly more risky than being outdoors, being indoors. But this goes to, obviously, volleyball is being played now, but volleyball, basketball will be moving indoors, soccer. I think that it's still going to be a little bit more risky. Certainly when they're on the sidelines and not doing active drills or games, I think masking is going to be very important to do that. At that time, you know, can you wear a mask when you're playing? We've always found it hard to endorse that just because it is so uncomfortable. It is difficult. You'll have plenty of gas exchange, but the heat that will be retained will be probably significant. But also once it starts to get sweaty, it's probably not as effective as more of a dry mask as well. So there are a little bit details in there. But again, I think certainly indoors is going to be a little bit more risky, and especially if you are spectating and sitting on the sidelines, watching your child do that, you're going to be in fairly close proximity with other people as well during that.
All right, another viewer wants to know, is the COVID-19 virus aerobic, meaning it needs oxygen, or is it anaerobic? I think I said that right, meaning it doesn't need oxygen. And why is this important to know?
Yeah, I don't think it is important to know. So it's typically for bacteria, we have aerobic bacteria, meaning they can grow in a certain partial pressure of oxygen, and anaerobic bacteria, meaning they grow with less oxygen in that environment. For the virus, it doesn't matter at this point. There's really no distinction between aerobic and anaerobic and again, that's for most viral infections because they are completely different organisms from bacteria, which need to be doing those metabolic things within the bacterium to live and survive. Viruses really are not alive in the sense they are infectious and can be culturable, but they are not alive. They need other cells, particularly host cells like us, our cells, to really reproduce and cause replication.
Any comment you want to add to that?
No. That was
All right. What are your recommendations for trick-or-treating this year? My neighbors even stopped me the other night, and they were asking because they watched this program.
So the CDC has come out with some recommendations, and it's really what they've laid out are kind of options in different categories of risk, so low risk, medium risk, and high risk. Trick-or-treating, unfortunately, does fall into that higher risk category, and that's because typically trick-or-treating involves groups of people going to a community bucket to grab candy out of it, which are all things that we're not recommending. But can you do it safely if you're just with your bubble and you're really paying attention to that spacing, clean hands only going into those buckets as soon as you take your hands out, again, hand hygiene, and then of course, once you unwrap the hopefully single wrap candy items, again, clean hands would probably reduce your risk. But I think it's important to acknowledge that there is risk whenever you're introducing different folks into your bubble, going to your neighbors' homes, which is different than the folks that you live with, does introduce that risk. There are recommendations of going on a scavenger hunt, so you're not actually putting your hand into somebody else's candy bucket, and also encouraging, if you're handing out candy yourself, that you're the one handing it out rather than people putting their hands in. So it's only one hand in versus a whole bunch of hands into the bucket.
Kind of like when we're serving food to a big group.
Exactly.
Yeah, I mean, certainly the traditional trick-or-treating is, I believe, in the highest risk category for the CDC guidelines. You know, I have a little bit of, not really problem with that. I would certainly agree, but there are ways that you can do it. Like Amanda said, if you have smaller groups, your interaction with that other person who you're getting candy from is going to be very brief, certainly not 10 or 15 minutes. Hopefully you'll have a mask on, or your children will have a mask on, and the person doing the trick-or-treating will have a mask on as well. More important, I think, as Amanda talked about, would be the hand hygiene and the fomites, or the inanimate objects that you're getting, such as the candy bars and things of that nature. So, you know, wear the mask, stay in the small groups. Certainly outside is great. You can walk around outdoors, especially if you can try and be distance as much as possible. And again, make sure you have alcohol gel so you can do that adequate hand hygiene.
I know yesterday that our guest who was with the health department, Julianne Van Loo, said, you know, she goes, I'm not so worried about the little kids. She goes, it's the older kids and the adults.
Yeah, certainly. And we know because, you know, I think for the most part, you know, the children, so the older kids, in what we've seen, obviously not around here so much, but the older kids that are in high school, I don't know if there's a lot of infections through the schools itself, but just as you talked, when it's the adults or the older kids who are getting together outside of those school settings, or even in the college settings, in the classrooms, on the campus it's safe, but when they get out into those other settings where they are being social, that's when we see a lot of these infections occurring.
Yeah, and she commented yesterday as well that this is, you know your neighbors, you become real, I mean, you're familiar with them, so it's easier for you to let your guard down. So I think that also poses a little bit of a risk.
Yeah, that's right. All right, Bob, any more questions?
Yeah, here's one from Lori that I think a lot of people are probably asking right now. It says, we had our first cases in elementary school of COVID-19 that caused some classrooms to be sent home. The parents of the students that were exposed in the room were told to quarantine those kids that were exposed, but other family members were able to return to school or work. So what's the expectation of quarantine rules when children and households are involved? My husband and I have debated on this and who needs to stay home.
Yeah.
Sure. So whenever we have a known exposure, we go off of the contact tracing guidelines and identify who is what is a close exposure. Those definitions may actually change by county, depending on one thing that typically is a factor is the duration of time in which you were around a known positive individual. So the CDC says 15 minutes, but I know KDHE recommends, or we call somebody a close contact if you were within 6 feet, regardless of a mask, for 10 minutes or longer. So once they do that contact tracing, if they've identified a group of folks who meet that criteria, those individuals, and if it's a young child, most likely their household, like the parents, will also likely need to be quarantined just because they're in close proximity. Although if they're quarantined, they probably have to stay home with them. I mean, if they're underage, they can't stay home alone, that type of thing. But typically, you're actually not considered exposure if your child was the one who was exposed.
Yeah.
And the quarantine period is the 14 days. You can't test out of that. I know we get that question quite often. Well, we tested negative on day 4 post-exposure. Why do I have to stay in quarantine the whole time? And again, I think that's been discussed multiple times. You can't test out of quarantine. But if you didn't meet the close contact definition, then you wouldn't be indicated for any kind of quarantine.
Yeah, I think talk with your county health department about that, but certainly if the child is exposed, the child will be a contact. You, at that point, or the parents or the adults in the household will be a contact of the contact. So it's difficult, and we know that people do have to go back to work. So typically contacts of contacts are not necessarily made to quarantine. But again, we know this virus can spread easily. Attack rates in the house, meaning secondary infections that occur if somebody is infected, typically run about 15, 20, maybe 30% in some of the studies. So it's not an insignificant amount of people that can be infected in the household.
Bob?
I think we have time for another one here. This is from Isaac. Have to look in the future a little bit here. When we get the vaccine, will the person who administers it give you a card or a wristband of some sort saying that you've received it? I can imagine having to show this to security in order to get into a movie or a game or a concert.
Yeah. Well, you know, this goes back to, again, a few different questions here. This goes back to an immunity passport, which I don't know how reliable that is, especially if you've had the infection once. We think that you have some durable immunity for a few months, 2 or 3 or 4 months, but there is that risk of reinfection. So even if you get an antibody test, was that going to be on your immunity passport saying that you had it? Well, we know you can be reinfected, so I don't understand, and I don't believe that that's going to be a big issue. If you get the vaccine, you may get a card, but I think that's more important because there will be different vaccines on the market. A lot of these vaccines are going to have more than one dose, and so you're going to need that card, you're going to need that information so that you can get the same company's vaccine when you go back for that second dose, or even if you need a booster down the line. I don't think it's really going to be reasonable to do that, to go to movies or concerts or go out and use it as an immunity passport, no.
Yeah, I would agree with that.
Are we done with questions? All right, so I want to just tell everybody, such great, smart questions. Oh my gosh, I every day I'm kind of like, gosh, I wish I would have thought of that. That is a great question. And I'm going to ask you guys for your final thoughts here in just a moment. But first, I want to tell you what's happening on Monday. We're going to have Dr. Mark Parrish, who's in maternal fetal medicine. He's going to join us to dive deeper into that recent CDC report linking COVID-19 to preterm and stillbirths. He's going to share what he tells his patients about being pregnant during a pandemic and if now is a good time to conceive. And I got to tell you, he sent me some of his talking points last night, and they were pretty eye-opening. So I'm just going to leave it at that. We've had a lot of babies born here, and he's going to tell you how things are happening around here. So good advice. Invite you to tune in. Before we go, Amanda?
Yeah, so we got all of our flu vaccine in earlier this week, so I think this is just a really good time to remind everyone to get their flu shot.
Right, and we do have a public clinic, I believe, also over in the medical pavilion that is now open too. So.
Okay. Yeah, you know, we know that cases are going to fluctuate. Continue to look at those rolling 7, 10, 14-day averages, not focusing so much on the day-to-day information. Hopefully there will be a change and we will have less cases per day, but certainly the last week or so, our rolling 7-day average in the Kansas City area has increased. Continue to distance, especially I think it's going to be nice this weekend. If you can be doing things outdoors, that's much better. But as we get into the colder season now, it will be indoors. That's why the distancing, the masking, the hand hygiene, the not going out unless you need to is going to be so important moving forward.
I'm so excited for the weekend.
Yeah.
I hope you guys are at home too. As we say goodbye this morning, I want to show you a couple of photos. Annie sent in this photo of the Blue Valley North Mustangs showing that high school volleyball teams are wearing masks while they compete in hopes of being able to play as long as they can. And this is a look at Guy. He is in good company. Both of these guys, these young men, are great role models wearing their masks. We want you to keep those mask pictures coming in. Here's where you can send them. And I would like to challenge you. Monday is Red Friday, and I have a mask photo that I've been saving to show you. If you've got great pictures of how you celebrate with the Chiefs and maybe how you're wearing your mask or your colors, send those to me over the weekend and today, and we'll share them on Monday. In the meantime, everybody, make it a great weekend. Stay safe.